Hey guys, Brian here, and what we're going to go over today is a request from one of our followers is how to deal with knee pain. Now, a lot with knee pain, what we see is an overactive quad muscle, so that's what we're going to focus on this morning. Specifically, we want to look more at this distal or closer to the knee quad opposed to higher to the hip. A lot of times when we don't have good hip control, good glute activation and stabilization of that hip joint, then we see that a lot of that force goes downwards towards the knee, towards the ankle. So a lot of times right above that knee joint can get really gnarly in there. So we want to spend a little bit of time on it today. There's two different tools we can use. We can use the lacrosse ball and we can use the foam roller. Now, with any mobility technique, a lot of it's going to be pin and stretch. A lot of it is going to be that we need to compress the tissue and actually create shearing force by creating some type of range of motion movement. So when we do this, we want to make sure that we're pinning down that quad muscle and then trying to bend our knee back and forth. So to use the foam roller first, and I like to do that first because it gets more of that general type of mobility work versus more specific work that we'll do with the lacrosse ball, we're going to start on our stomach. So on our stomach, we're going to get that foam roller right into the inside, right above that knee joint. And what we're going to do here is kind of lock down on a place that's kind of tender. And we're just going to bend that knee up as far as we can comfortably and back down. You're just going to do this for 5 to 10 reps. After that, you're going to work towards right above that knee joint, so right on the middle of that knee, again 5 to 10, and then we're going to work the outside 5 to 10. Now you can work all the way up the quad. If you have the time, ideally you're spending about 2 minutes on this. If you don't have that time, or you have more specific issues going on, then we want to use the lacrosse ball. And the lacrosse ball we can really pinpoint. It's a lot more sensitive when we do the lacrosse ball, but it can really dig in and it can really get a lot of those knee symptoms that can be referring from the quad to start to go away. So the big thing with this is the same type of movement. I'm on my stomach, I'm going to get into that nice tender spot. I'm just going to bend my knee back and forth, ideally trying to keep that ball as still as I can, so I'm putting as much pressure as I can tolerate and just moving back and forth. Now, with any type of soft tissue work like this, you want to follow it up with some type of motor control work. You've increased that range of motion, now you need your brain and your muscles to understand what needs to fire now so you don't continue to keep irritating that tissue. So one I like to give so this is a little bit of a bonus, is I like to do a knee hole bridge. So from here, one knee is locked into my chest, this knee is slightly inside of my foot. I'm using that glute tissue, or those glute muscles, to engage my hip and go up and down. Now I'm trying to keep that tension in that glute the entire time. Doing about 20 to 30 of those reps right after some soft tissue work is really going to help change long term what is happening with that lower extremity. So give that one a shot and let us know if you have any questions.